Blood, they say, is the unit of life. And do you know that when people are giving out blood, somehow they're giving out life? But sometimes a person that is so healthy, something will happen, they'll take the person to the hospital, and then the next thing you hear is shortage of blood. Where did it go to? You're not bleeding. There's no physical place where your blood is leaking out of your body. But something happened that caused your blood to short. This is what we'll be discussing today on Health Unplugged, brought to you by Lifeway Medical Diagnostic Hub. I'm in the studio with Dr. Dimba Favor. My name is Amazing Rita. Welcome, Dr. Favor.
Thank you very much.
We'll be talking about anemia, the shortage of blood. Let's learn what causes it, how to prevent it, and if one should have shortage of blood, what it can cause in the body, and learn about it. So Dr. Favor, tell us, what is anemia and how does it affect the body?
Anemia is a reduction in hemoglobin content of the blood. Don't worry, I'll explain what hemoglobin is. Or a reduction in the red cell mass.
Okay.
Yes. You know the blood has the cell components and then the serum. The cell components, we have 3 types of cells in the blood. The red cell, red blood cells, white blood cells, and the platelets. Then the liquid part is the serum. Do you understand? So a reduction in hemoglobin content or reduction in red cell mass, red blood cell mass is what anemia is. So what is hemoglobin? Hemoglobin is the red part of blood that carries oxygen. That they call it the oxygen carrying capacity of the blood. So when this hemoglobin is reduced or when the total red cell mass is reduced, this person is said to have anemia. WHO, that's World Health Organization, they say is when hemoglobin content is less than 11 grams per DL. This person is said to have anemia. Yes. Anemia does different things to the body. Things like it can cause the person to be very weak. Yes. Generalized weakness, fatigue. Fatigue is just like a term for weakness. It could cause this person to be lethargic. Like lethargy is like you're just irritated at everything. Then remember, this hemoglobin, iron is a component of the hemoglobin. So when this person is having anemia, one of the things, iron is a component of hemoglobin. So in a state of anemia, the iron could equally be low. So it could cause reduced attention span or concentration. It could cause irritability. These are some things anemia could cause in the body.
Are there different types?
Yes, there are different types of anemia. But these different types is based on, I want to group it into some headings. Based on the morphology. Morphology here, I mean, when you see the red blood cell, what are you seeing? Some could be microcytic. Microcytic anemia is when the mean corpuscular, I just want to explain it in a lay way. Yes, when the mean corpuscular volume is less than 80. In microcytic, the size of the red blood cell is small, micro. Then, remember I said for microcytic anemia, the red blood cell is small, the mean corpuscular volume is less than 80. Then we have normocytic. This one is normal. This person is normal. The person is not having any form of anemia. The red blood cell, the sizes are normal. And then the mean corpuscular volume is between 80 to 99. Then we also have macrocytic. This is where the mean corpuscular volume is greater than 99. That's 100 and above. And then the red blood cells here are big. We can also classify anemia based on the cause. We have hemolytic anemia. Hemolytic anemia is a type of anemia where this person's hemoglobin or red blood cell mass is reduced because the person has been bleeding. The red blood cells have been undergoing hemolysis. Then there are some types of anemia that could be caused from parasitic infection, worms like hookworm, trichuris, trichuria. These are some types of anemia we have.
So the classification is based on how they are.
We have based on morphology,
Morphology,
how they look.
how they
We
look.
have based on etiology, the cause.
The cause.
We also have, I just decided to keep it at that because
Okay.
we have other types.
Other types.
We also have based on the pathophysiology.
Okay. So
Exactly.
tell me, how does anemia reduce the amount of oxygen in the blood?
Okay. Remember I said, I defined anemia as a state where the hemoglobin content is reduced or the red blood cell mass is reduced. And also recall I said hemoglobin is the oxygen carrying capacity of the blood. Beautiful. Iron combines with protoporphyrin to form what we call heme, which is a component of hemoglobin. While globin is the protein. I don't know if it's making any sense.
Yes.
I said iron combines with protoporphyrin to form heme. Beautiful. So this hemoglobin is what oxygen binds to in the blood. Like when you get a red blood cell, it's the hemoglobin component of it that the oxygen binds to. Exactly. So that's why when someone is having anemia, the person's hemoglobin is reduced.
Yes.
It means there's no sufficient hemoglobin to bind to sufficient oxygen needed in the body.
Okay. What are the common symptoms of anemia?
Common symptoms of anemia. This person could come down with weakness. The person will just be feeling weak, fatigue, unnecessarily weak. The person could have palpitations because in this instance now, the body is sensing that there's no sufficient oxygen in my body. A state of anemia, hemoglobin is reduced, so there's no sufficient hemoglobin to bind to sufficient oxygen. So the body is like, my body is not getting sufficient oxygen. And the body is trying to compensate. The body is thinking maybe there's no sufficient blood, not knowing that, okay, the body is thinking there's no sufficient blood, so it's making the heart pump faster and harder than it should. That's why this person will start having palpitations. This person could even come down with fainting spells because the person can faint because the brain is not getting sufficient oxygen. Because the hemoglobin content of the blood is reduced. These are some symptoms this person could come down with.
Can someone have anemia without knowing it?
Yes, it's very possible. Anemia is graded into mild, moderate, and severe. So somebody could have a mild form of anemia, and then the person is asymptomatic, the person is just normal because it's the mild form. So it's very possible for someone to be anemic without having symptoms or having any feeling of weakness or all those symptoms we explained earlier.
If someone begins to notice that they have anemia, is there anything that could be causing it?
Yes, there are different things that cause anemia. Yes, it could be from excessive blood loss.
Okay.
Somebody that is bleeding, maybe even some people that have ulcer, maybe the ulcer has perforated.
Yes, not
it
bleeding
could cause
ulcer.
bleeding. Yes, the person could even vomit blood, or the person had a road traffic accident, or just something that caused the person to lose so much blood. It could be from parasitic infections, like hookworm, trichuris. They go and then they infest. They cause ulcers on the intestinal wall. So these ulcers, and then they equally affect the blood vessels, leading to leakage of blood. Another thing they do, the ileum, there's a part of the intestines they call the ileum. This ileum is responsible for reabsorption of some vitamins that are very important for formation of red blood cells, like vitamin B12 and folic acid. So if these organisms, these parasites, the hookworm, trichuris, trichuria, if they go and destroy that part that part will not be able to absorb these vitamins that are needed for blood formation. So it could also be from diet. Some people don't eat properly, especially vegetarians, vegans, because plants are very rich in other sources of food, but they are not so rich in iron content.
Okay.
Some of them have a form of iron, but not the one that is readily available to the body. So we get more of iron from animal sources.
Okay.
So vegans, they are strictly on vegetables.
Yes.
They try to avoid animal sources of protein or whatever. Exactly. So especially vegans, most of them come down with iron deficiency anemia. Some people have some congenital defects like sickle cell anemia. So these people, their red blood cell has a sickle shape.
Okay, yes.
And when they are exposed to things that trigger them, their triggers, these red blood cells, they begin to lyse or get destroyed. So most times they have anemia. Some people who have had some surgeries where they removed maybe gastrectomy, where they removed a part of the stomach. And then I told you the ileum is a part where reabsorption of some vitamins take place. So some people who have ileostomy, some kind of surgeries where they remove that area, those people can no longer absorb these nutrients that help in production of blood cells. Some people have some form of bone marrow deficiencies. And remember, the bone marrow is where these blood cells are produced. Some people have some leukemias, cancers of the blood, so they can't produce appropriate quantity of red blood cells. Some people, anemia can also be from some chronic diseases. I remember in one of our sessions where we talked about kidney disease.
Yes.
The kidney, remember I said, produces erythropoietin. Erythropoietin is like the substrate for production of red blood cells. So someone having chronic kidney disease can no longer produce erythropoietin. So this person will most likely have anemia. So these are some causes of anemia.
What of heavy menstruation in women?
Exactly. So people who lose blood heavily, menorrhagia, they can come down with anemia, especially if post bleeding, like after the menstrual flow, they don't try to build up. Also, people who donate blood too frequently, because remember the lifespan of the red blood cells is about 120 days. So people who donate 120 days is like 3 months, 3 to 4 months. So people who donate blood like at very, very, very short intervals, they are also at risk of having anemia.
Okay, is anemia hereditary or it can happen to anyone?
Some forms of anemia can be hereditary, and equally, anemia can happen to anyone. So some forms are hereditary, some could happen to anyone.
So, what of women that are pregnant? Can pregnancy increase a woman's risk of being anemic?
Yes, pregnancy can increase a woman's risk of being anemic because in pregnancy, there's an increased demand for iron. So if the woman is not getting enough, she could be at risk of anemia. Secondly, many women who have multiple gestation, like those who are pregnant for multiple babies, twins, triplets, imagine being pregnant for one. And in pregnancy, it's just a physiological change. Physiologic means it's not like a disease-causing state. It's just normal. In pregnancy, there's a physiological state that involves increased demand for iron. So imagine a woman pregnant with one child, having an increased demand for iron. Then imagine someone pregnant for 2, 3, 4, as the case may be. The demand will be higher than the demand for this person pregnant with just one. So multiple gestation can also cause an increased risk in pregnancy.
Okay, how is anemia diagnosed?
Anemia can be diagnosed from, first of all, the history taking. In the history, you want to confirm, are you always feeling weak? Like when you do little things, do you start having dyspnea on exertion? Like when you do little things, do you start having dyspnea? That's dyspnea at rest, or dyspnea with mild exertion, or dyspnea with moderate exertion. Dyspnea is difficulty in breathing. Do you feel your heart beat? That's palpitation.
Yeah.
Did you have anything like trauma? Like, did you have an accident? Just anything like that. For a female, you want to ask, how is your menstrual flow? Like, do you lose excess blood? For people who donate blood, you want to know the frequency at which they donate blood. So these questions will give you an idea. Remember, in medicine, your history taking gives you about 70% of your diagnosis.
Okay.
Then investigations help you with the remaining 25 to 30. So after getting a good history, you want to do some investigation. You also have to do your examination. For someone who is anemic, when you look at the eye, the conjunctiva, they call it conjunctival pallor, you see that it's pale. You can also look at the palms, the soles of the feet. You can also look at, on the palms, what you're checking for is these lines. You see that they look pale. They don't look their normal color.
Yes.
Then you can also check, you can also check the mucosa. You see it looks pale. So these are some things you can elicit on examination. Then you can send for some investigations, like the full blood count. In full blood count, you can do PCV to save cost. If you're trying to save cost, PCV will still give you, full blood count is just like a broader component, but you can get PCV in it. It will show you the amount of hemoglobin or the red blood cell count. You can also do other investigations to rule out and make sure that there are no parasitic infestations. You could do a stool, MCS, a stool culture. You could do a stool analysis to know if you find the ova of the hookworm, the trichuris in this stool, because this will give you an idea that these worms are actually in the body. Exactly. So these are some ways to make diagnosis of anemia. But remember, anemia is not a sickness.
Yes.
Anemia is not an entity on its own. Anemia is just a symptom that different diseases could present with.
Okay.
Exactly.
Okay. Walk us through the process whereby anemia becomes life-threatening.
I didn't get the question.
Like, walk us through a scenario where, and like, what causes it to just be an ordinary shortage of blood to a life-threatening condition?
Okay. In a case where someone was tested and then it was discovered that this person has mild anemia. Remember I said anemia can be grouped into mild, moderate, severe. And then this patient was counseled to build up his or her blood through dietary means or use of hematinics, and the person ignores it. The anemia could further worsen, leading to life-threatening condition. Another scenario, imagine a case where a child is having severe malaria and nothing is done about it. In severe malaria, the red blood cells are lysed, they are broken. This will now make the spleen, because that is where the red blood cells are destroyed. It will now make the spleen get larger than normal. And then, remember I said these red blood cells are being destroyed faster than they should.
Yes.
So this child is having anemia, and then maybe the parents are not really doing anything about it. They're just maybe giving the child paracetamol or just trying to do self-medication, practice self-medication. It will get to a point where that anemia will get, where that malaria will get very complicated, and one of the complications will be very severe anemia, such that if that child is not transfused, the child could die. Remember I said palpitations is one of the symptoms anemia could have. So imagine a case where the child is not properly attended to, this child could die. Imagine a situation where the bone marrow is having issues, or this patient is having just a problem with the bone marrow. Maybe a case where the bone marrow is producing excess or too small. So, but in this scenario, where we're talking about anemia, we're talking about too small or nothing. We call that aplastic anemia. The bone marrow is not producing red blood cells at all. This person is at risk of severe anemia. So,
All right. Are there some food that we eat that can actually cause shortage of blood? Is there anything like that? Or should I say food that we eat that will obstruct your body's production of blood?
okay, not in the sense of obstructing
Okay.
it, but like milk now, what milk does. Remember I said iron is a component of the hemoglobin.
Yes.
It combines with protoporphyrin to form heme, and then the heme combines with the globin component to form hemoglobin. So imagine milk, what milk does is that it slows down the absorption of iron.
Okay.
That is what milk does. I don't know if you've seen a situation where someone goes to the hospital and then the person wants to take anti-malaria, and then they'll tell the person you can take it with milk.
Yeah.
Exactly. This is because milk slows down absorption of iron. And why do we want milk to slow down the absorption of iron? Those microbes, the falciparum, they feed on iron. Iron is helpful to them. So we don't want so much iron in circulation. We want the absorption of iron to be slowed down. So milk is one of the food that does something like that, but not that it stops the production of iron in itself. Yes.
What can we do to prevent anemia?
First of all, healthy diet. Yes, because diet has a very huge role to play. For example, you can get vitamin B12, B9 in diet. So people who are malnourished, poorly fed, they won't be getting enough of this.
Yes.
Secondly, before people who donate blood, they should make sure a thorough check is conducted on them before they are asked to donate. If their blood level is not optimal, they should not be allowed to donate, irrespective of the scenario or the condition. They should find
another person
donor
as a substitute. Yeah.
Yes. Then for people who have the sickle cell anemia, the parents or the individuals themselves, they should try to avoid triggers, because anything that is a trigger to them would cause that their red blood cell to be lysed, because it has a sickle shape. So once they are exposed to anything that triggers them, it will cause lysis of their red blood cells, hence leading to anemia. So they can try to avoid triggers.
Okay. For someone that is suffering from anemia, or should I say severe anemia, and then there's a blood transfusion, so can the person recover fully after that?
Yes. People with severe anemia recover fully after transfusion.
Okay. Can continue, please?
Yes. It depends on the severity.
Okay.
The severity will tell you the number of units or pints to be transfused. However, in the case of transfusion, there are still precautions to take. Because like someone who has been transfused up to 3 units of blood, 4 units of blood, we must look out for hyperkalemia. There are some little things to look out for here and there, so that this person does not go into hyperkalemia, which will affect the heart. So blood transfusion can be used to correct severe anemia, and the person can get fine.
But it's not all kind of anemia that requires blood transfusion.
No. Not all forms of anemia requires blood transfusion. Just like I said, anemia is grouped into mild, moderate, severe. Just people with severe anemia. Most people with moderate or mild, there's blood workup that could be done for them, and then they can get fine without transfusion. Those who are having iron deficiency anemia, they can step up their iron components, and then the anemia is sorted out.
So that's anemia in the body. Can it lead to other complications?
Yes,
like
anemia in the body can. Generally, remember, in our definition of anemia, hemoglobin, reduction of hemoglobin. Remember, hemoglobin is the oxygen carrying capacity of the body. So imagine any part of the body that is not getting sufficient oxygen can get affected.
Oh.
Blood runs all through the body.
Yes.
It runs in the blood vessels. Blood vessels are in every part of the body. So it means every part of the body can get affected in the case of severe anemia.
Okay.
But then it gradually starts with the vital organs, the brain, the heart, the kidney, the spleen as well.
All right.
Yes.
So, if you are trying to in the course of preventing anemia,
Yes.
is it advisable to always do your full blood counts?
Yes, it's advisable. However, not by yourself, with the direction of your healthcare provider.
Yes.
It's very much advisable because there's something called iron overload, and it
Okay.
can have its own effect. And then even there's something called polycythemia. It's not like it's in excess. So everything should be in moderation. So that's why it's advisable, as you're being transfused or as you're correcting your anemia, you check what is being corrected and check the results you're getting.
Okay.
Yes.
All right. Thank you so much, Dr. Favor. I think this is where we draw the curtains on today's episode.
Okay.
This is Health Unplugged, brought to you by Lifeway Medical Diagnostic Center. We just talked about anemia. There are some people that will be suffering from anemia and they will not even know it.
Exactly.
Probably because you've not gone to the hospital to check what's wrong with you, or you are still trying to manage the symptoms that you are seeing.
Yes.
And because your body is not getting enough blood, it can lead to severe complications.
Exactly.
And even is life-threatening. You can even lose your life, where just a simple, the doctor diagnosing that this is anemia, and then you probably eating well or getting a blood transfusion could have just helped. Let's not even talk about those that even reject blood transfusion in a case where it's very important that you get it. But please make sure that if you're having any symptom like you do, if you're having headache, palpitation, you're having drowsiness, and you know it's not normal, and you've watched over time, it's not getting any better, it's better you see a doctor, because that could be anemia. And for those of you, let me not even say it like this. Dr. Favor, help me tell them, malt and milk, what quantity of blood does it give?
Okay, malt and milk. I know people do say when I mix malt with milk, it will help build
my blood.
But that's a very, very wrong perception.
I'm just enjoying.
Not in the sense that it won't build the blood, but in the sense that combining it does not help build blood. Remember what I said? Milk inhibits the absorption of iron. So when you combine it, it's just like you're giving a counterproductive result. Do you understand? You can take them separately, but not together. Because I explained earlier that milk prevents or inhibits the absorption
of iron. Okay. So while you are enjoying your malt and milk, try to eat your vegetables. That will help. Yes. And enjoy your malt and milk by yourself. Till we come your way again next time. My name is Amazing Rita.
Number 20 Favor.
I will see you next time. Bye.